Medrizer Academy for medical assistants.
Healthcare assistant interview question and answers. First question. Tell me about a time when you dealt with a challenging behavior from an elderly resident and how did you handle it? This question can be answered in a star method because it's a question from your experience. So you have to give the situation, task, action and the result. Let us see how we can answer it. Situation. In my role as an aged healthcare worker, I encountered a situation where an elderly resident displayed challenging behavior such as aggression or resistance to care. Task. My task was to respond to the challenging behavior in a calm and professional manner, ensuring the safety and well-being of both the resident and the care team. Action. I assessed the situation, taking into account and trigger or underlying causes for the behavior. I remained calm and composed, understanding that the resident's behavior may stem from confusion, frustration, or fear. I employed de-escalation techniques such as using a soothing tone and offering choices whenever possible. I ensured a safe environment by removing any potential hazards and seeking assistance from colleagues. I communicated with the resident, acknowledging their emotions and attempting to redirect their focus to a more positive or engaging activity. Result. By employing these strategies, the challenging behavior gradually subsided and the residents' well-being was maintained. Second question. What are the importance of effective communication? Effective communication in healthcare assistant is crucial for several reasons. First, patient safety. Clear and accurate communication between healthcare professional and patient can prevent medical errors and ensure the safety of patients. Miscommunication or misunderstanding can lead to incorrect diagnosis, medication errors, or incorrect treatment, resulting in harm to the patient. Second point, patient understanding. Effective communication helps patients understand their medical condition, treatment options, and healthcare instructions. When patients are fully informed, they are more likely to comply with the treatment plans and actively participate in their own healthcare, leading to better outcomes. Next point, trust and confidence. Clear and empathetic communication builds trust and confidence between healthcare professionals and their patients. This trust is essential for patients to share sensitive information, ask questions, and have open discussion about their health concerns or fears. Fourth point, collaborative care. Effective communication promotes teamwork and collaboration among healthcare professionals. It allows for seamless exchange of information, coordination of care, and integrated treatment plans, resulting in improved patient care and outcomes. Fifth point, empathy and emotional support. Good communication skills enable healthcare professionals to empathize with patients, understand their emotional needs, and address their concerns. Compassionate communication can provide comfort and support to patients, making them feel valued and cared for during their medical journey. Sixth point, cultural sensitivity. Effective communication is essential to establish cultural competency and overcome language barriers. Healthcare professionals who can understand and respect diverse cultural and linguistic background can provide inclusive care and tailor their communication strategies to individual patient needs. In summary, effective communication is essential in healthcare assistance to ensure patient safety, facilitate understanding, build trust, encourage collaboration, offer emotional support, and provide culturally sensitive care. Next point. What are the job responsibilities of a healthcare assistant? This is an important question that all the healthcare assistant should know. Answer. A healthcare assistant plays a crucial role in the healthcare industry by providing support and assistance to healthcare professionals. They work closely with nurses, doctors, and other healthcare professionals to ensure the smooth functioning of healthcare facilities and the well-being of patients. In this article, we will discuss the job responsibilities of a healthcare assistant. First point, hand hygiene. Wash your hands thoroughly with soap and water before and after each patient contact. Use hand sanitizer if soap and water are not available. Second point, personal protective equipment PPE. Wear appropriate PPE such as gloves, masks, and gowns as necessary to prevent the spread of infection. Third point, patient identification. Always verify the patient identity before providing any care. Use two patient identifiers such as their name and date of birth to ensure accuracy. Fourth point, vital signs. Take the patient's vital signs including temperature, blood pressure, pulse and respiratory rate as ordered by the healthcare provider. Record the result accurately. Fifth point, patient positioning. Help patient to get into the comfortable position for examinations or procedures. Use proper body mechanisms to prevent injury to yourself and the patient. Sixth point, assisting with mobility. Assist patient with walking, transferring to and from bed or chairs, and using assistive devices such as walkers or canes. Follow proper lifting techniques to avoid injury. Seventh point, assisting with the activities of daily living. Help patient with tasks such as bathing, dressing, grooming, and toileting. Respect the patient's privacy and dignity during these activities. Eighth point, documentation. Accurately document all patient care activities, including vital signs, procedures performed, and any changes in the patient condition. Use appropriate medical terminology and follow facility protocols for documentation. Ninth point, infection control. Follow proper infection control procedures including hand hygiene, wearing PPE, and properly disposing of contaminated materials, clean and disinfected equipment and patient care areas as needed. Emergency response. Be familiar with the facility's emergency response procedures and know how to respond in case of medical emergency. This may include calling for help, performing CPR, or using an automated external defibrillator, that is AED. Communication. Maintain clear and effective communication with the patients, their families, and other health team members. Listen actively, ask questions, and provide information in a compassionate and professional manner. 12th point, patient advocacy. Advocate for the patient needs and performance, ensuring they receive appropriate care and support. Report any concerns or changes in the patient's condition to the healthcare provider. 13th point, professionalism. Maintain a professional and respectful attitude towards patients, colleagues, and other healthcare professionals. Uphold patient confidentiality and adhere to ethical standards and facility policies. 14th point, continuous learning. Stay updated on current healthcare practices and procedures through ongoing education and training. Seek opportunities for professional development to ensure your skill and knowledge as a healthcare assistant. In conclusion, health assistant provides valuable support to healthcare professionals and contribute to the overall well-being of patients. From assisting with the daily activities to monitoring vital signs and maintaining a clean and safe environment, healthcare assistants play a vital role in ensuring the efficient and effective delivery of healthcare services. Next question. What is your idea about manual handling methods? As a healthcare assistant, it is important to be aware of proper manual handling methods to ensure the safety and well-being of both myself and my patient. Here is some information on manual handling methods, especially for healthcare assistants. First point, assess the situation. Before carrying out any manual handling task, assess the situation to determine whether I am capable of performing the task safely. Consider the weight and size of the object or patient, any obstacle in my path, and my assistance or equipment that may be required. Second point, use mechanical aids. Whenever possible, use mechanical aids such as hoist, slide, seat, or transfer boards to assist with moving patient. These aids can significantly reduce the risk of injury and strain. Third point, communicate with the patient. Before attempting to move a patient, communicate with the team to ensure they understand what are going to do and why. Encourage their activities participation by asking them to help as much as they can. Fourth point, a plan ahead. Plan your movements before initiating any lifting or transferring task. Be sure to consider my posture and positioning during the task so that I can maintain stability and balance. Fifth point, use proper lifting techniques. When lifting objects or patients manually, it is essential to use proper lifting techniques. Bend my knees rather than my back. Keep my back straight and avoid twisting or jerking motions. Get a good grip on the object or patient using both hands. Lift with my legs, not with my back. Engage my core muscle to support my spine. Sixth point, seek assistance when needed. If a patient weight exceeds, I can safely handle alone. Always ask for assistance from colleagues or use mechanical aids if available. Seventh point, take breaks and peace of myself. Manual handling can physically demanding. Take regular breaks between tasks and avoid overexertion by pacing yourself throughout the day. 8 point, attend training sections. It is important to attend manual handling training sections and stay updated on the latest techniques and equipment. Regular training will help me to maintain good posture, reduce the risk of injury, and improve my overall manual handling skills. Remember, proper manual handling techniques are crucial for both personal safety and patient care. By following these guidelines, I can minimize the risk of injury and create a safe environment for everyone involved. Next question can be, what is your idea about fall risk assessment and prevention? As a healthcare assistant, it is crucial to take preventive measures to prevent falls in patients. Here are some general steps to follow. Conduct a fall risk assessment. Identify patients who are at higher risk of falling using a fall risk assessment tool. This assessment may include evaluating their mobility, strength, balance, cognition, medication use, and history of previous falls. Second point, communication. Ensure you have effective communication with the patient to understand their specific needs and concerns. This includes attentive listening and providing clear instructions. Third point, environment. Access and mobility. Modify the patient environment to reduce fall risk. This may involve removing trip hazards, securing loose carpets or rugs, keeping walkways clear, improving lighting, and installing handrails or grab guards where necessary. Fourth point, footwear. Encourage patient to wear footwear with non-slip shoes and well-fitted shoes. Encourage the use of loose slippers or socks that can increase the risk of slipping. Fifth point, assisting with mobility. Always assist patient in walking when necessary and provide appropriate walking aids such as cans or walkers, offer support and supervision during transfers, and encourage patients to ask for assistance before attempting any activity that may increase their risk of falling. Sixth point, medication review. Review the patient's medications and consult with the healthcare team to identify any medication that can increase the risk of falls, such as sedatives, muscle relaxant, or medication that affect blood pressure. Seventh point, balance and strength exercises. Encourage patients to participate in regular exercises and physical therapy tailored to improve balance, strength, and mobility. Depending on the patient's condition, assist them in performing these exercises safely. Thank you.